Hi, my name is Doctor Philippa Kaye, and today we're going to be talking about the symptoms of cervical cancer that you should never ignore. Cervical cancer affects the cervix, which is the neck of the womb, and approximately 3,200 people are diagnosed with it every year, and unfortunately about 850 people pass away from the condition. Cervical cancer has the potential actually to be eradicated by the combination of the HPV vaccination and cervical screening. Over 99% of cases of cervical cancer are linked to HPV, human papillomavirus, which is a virus that actually 4 out of 5 of us are infected with at some point in our lives, and most of the time our body's immune system clears it on its own. And actually about 70% of cervical cancer is caused by just 2 subtypes of HPV, type 16 and 18. Now, we do have an HPV vaccination program in the UK and a cervical screening program where you are called every 3 to 5 years depending where you live and how old you are for a cervical screening test. But it's really important that you also are aware of the signs and symptoms which could be cervical cancer. There might be a change to your bleeding pattern, perhaps bleeding in between the periods called intermenstrual bleeding, bleeding after the menopause or bleeding after sex. There may be a change to the discharge. Your vaginal discharge might increase, or you might notice that it is blood-stained. There might be pain during or after sex, or more generalized pelvic or lower back pain. Or you might be feeling very fatigued or have unintentional weight loss. If you develop any of those signs or symptoms, it's really important that you go to the GP to get it checked out. The best thing that you can do to prevent cervical cancer is to have your HPV vaccination if you are eligible, regularly attend your cervical screening appointments, and also stop smoking. Please feel free to share this video to raise awareness, and if you have any signs, symptoms or concerns, get them checked out by your GP.